51. Which part of the body is most commonly affected by chorea and Huntington's disease? A. Upper limbs. B. Lower limbs. C. Face and neck.
D. Trunk.
Answer: C. Face and neck. Rationale: in Huntington's disease, chorea typically starts with the face and neck before spreading to the limbs and trunk. 52. Which of the following is a commonly used medication to manage chorea in Huntington's disease? A. Haloperidol. B. Diazepam. C. Fluoxetine. D. Levothyroxine. Answer: A. Haloperidol. Rationale: haloperidol, an antipsychotic medication, is commonly used to manage chorea in Huntington's disease. Diazepam is used for anxiety, fluoxetine for depression, and levothyroxine for thyroid issues. 53. Which of the following is true about genetic testing for Huntington's disease? A. It can predict the age of onset. B. It can identify the exact symptoms that will occur. C. It can confirm the presence of the HTT gene mutation. D. It is not recommended under any circumstances. Answer: C. It can confirm the presence of the HTT gene mutation. Rationale: genetic testing can confirm the presence of the HTT gene mutation, which causes Huntington's disease. It cannot predict the exact age of onset or the specific symptoms. 54. Which of the following is the most common cause of death in individuals with Huntington's disease? A. Cardiac arrest. B. Respiratory failure. C. Cancer. D. Suicide. Answer: B. Respiratory failure. Rationale: respiratory failure due to muscle weakness is the most common cause of death in individuals with Huntington's disease, especially in the later stages. Suicide and cardiac arrest may also occur but are less common causes of death. 55. How can cognitive decline in Huntington's disease be managed? A. Antidepressants. B. Cognitive behavioral therapy. C. Antipsychotic medications. D. There is no effective management. Answer: B. Cognitive behavioral therapy. Rationale: cognitive behavioral therapy can help manage some of the cognitive and psychiatric symptoms in Huntington's disease. Antidepressants and antipsychotics may help with mood symptoms, but there is no cure or definitive treatment for cognitive decline. 56. Which of the following is a common psychiatric symptom seen in Huntington's disease? A. Hallucinations. B. Delirium.
C. Anxiety.
D. Mania. Answer: C. Anxiety. Rationale: anxiety is a common psychiatric symptom in individuals with Huntington's disease. Hallucinations, delirium, and mania may occur, but they are less typical of the disease. 57. What type of testing is used to assess motor function in individuals with Huntington's disease? A. CT scan. B. MRI scan. C. Unified Huntington's Disease Rating Scale, UHDRS. D. EEG. Answer: C. Unified Huntington's Disease Rating Scale, UHDRS. Rationale: the Unified Huntington's Disease Rating Scale, UHDRS, is the standard tool for assessing motor, cognitive, and psychiatric symptoms in Huntington's disease. CT and MRI scans are used for diagnostic imaging, but not for assessing motor function. 58. How does Huntington's disease affect speech? A. Individuals may experience slurred speech. B. Individuals develop a high-pitched voice. C. Speech becomes rapid and incoherent. D. Speech remains unaffected. Answer: A. Individuals may experience slurred speech. Rationale: as Huntington's disease progresses, individuals often experience slurred speech due to the loss of motor control in the muscles required for speaking. Rapid and incoherent speech is less common, and the voice does not typically become high-pitched. 59. Which of the following is a common non-motor symptom of Huntington's disease? A. Blurred vision. B. Sexual dysfunction. C. Increased appetite. D. Night sweats. Answer: B. Sexual dysfunction. Rationale: sexual dysfunction is a common non-motor symptom in individuals with Huntington's disease due to both physical changes and the impact of psychiatric symptoms. Blurred vision and night sweats are not common, and appetite changes are less frequent. 60. What is the role of speech therapy in managing Huntington's disease? A. It helps with swallowing difficulties. B. It improves walking ability. C. It cures language impairment. D. It helps reduce involuntary movements. Answer: A. It helps with swallowing difficulties. Rationale: speech therapy is commonly used in Huntington's disease to manage swallowing difficulties, dysphagia, and speech impairments. It does not improve walking ability or reduce involuntary movements. 61. Which of the following is a characteristic feature of Huntington's disease in terms of the progression of symptoms? A. Symptoms progress in a slow, gradual manner over many years. B. Symptoms improve with age. C. Symptoms appear suddenly and escalate quickly. D. Symptoms remain constant over time. Answer: A. Symptoms progress in a slow, gradual manner over many years. Rationale: Huntington's disease progresses slowly over several years, with a gradual worsening of motor, cognitive, and psychiatric symptoms. Symptoms do not improve with age, escalate quickly, or remain constant. 62. Which of the following lifestyle changes is recommended for individuals with Huntington's disease to improve quality of life? A. Regular exercise and physical therapy. B. A high-fat diet. C. Complete bed rest. D. Avoiding any social interactions. Answer: A. Regular exercise and physical therapy. Rationale: regular exercise and physical therapy help improve mobility, strength, and overall function in people with Huntington's disease. A high-fat diet, bed rest, and social isolation are not beneficial for managing the disease. 63. Which of the following is the most appropriate first-line medication for treating depression in Huntington's disease? A. Lithium. B. Selective serotonin reuptake inhibitors, SSRIs. C. Antipsychotics. D. Anticonvulsants. Answer: B. Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs, such as fluoxetine, are often the first-line treatment for depression and Huntington's disease due to their safety profile and efficacy in treating mood disorders. Lithium and antipsychotics are not typically used first for depression. 64. Which of the following is a potential complication of Huntington's disease that can affect an individual's ability to swallow? A. Dysphagia, difficulty swallowing. B. Bradycardia, slow heart rate. C. Hyperglycemia, high blood sugar. D. Hemiparesis, weakness on one side. Answer: A. Dysphagia, difficulty swallowing. Rationale: dysphagia, or difficulty swallowing, is a common complication of Huntington's disease due to motor dysfunction affecting the muscles needed for swallowing. Bradycardia, hyperglycemia, and hemiparesis are not typical complications. 65. What is the primary cause of cognitive decline in Huntington's disease? A. Damage to the basal ganglia. B. Stroke. C. Lack of sleep. D. Environmental toxins. Answer: A. Damage to the basal ganglia. Rationale: cognitive decline in Huntington's disease is primarily caused by damage to the basal ganglia, which affects movement, cognition, and emotion. Stroke, lack of sleep, and environmental toxins do not directly cause cognitive decline in this disease. 66. Which of the following tests is used to confirm a diagnosis of Huntington's disease? A. Genetic testing for HTT gene mutation. B. EEG, electroencephalogram. C. X-ray imaging. D. Liver biopsy. Answer: A. Genetic testing for HTT gene mutation. Rationale: the diagnosis of Huntington's disease is confirmed through genetic testing for the mutation in the HTT gene. EEG, X-rays, and liver biopsies are not used for diagnosing this condition. 67. Which of the following is a significant risk factor for developing Huntington's disease? A. Family history of the disease. B. Exposure to certain environmental chemicals. C. High-fat diet. D. Lack of physical activity. Answer: A. Family history of the disease. Rationale: the primary risk factor for Huntington's disease is a family history of the disease due to its autosomal dominant inheritance pattern. Environmental chemicals, diet, and physical activity are not major risk factors. 68. In Huntington's disease, which of the following motor symptoms is typically most noticeable? A. Ataxia, lack of coordination. B. Chorea, involuntary movements. C. Tremors. D. Spasticity, muscle stiffness. Answer: B. Chorea, involuntary movements. Rationale: chorea, or involuntary movements, is often the most noticeable and debilitating motor symptom in Huntington's disease, especially in the early stages. Ataxia, tremors, and spasticity may also occur, but are less characteristic. 69. What is the goal of using antidepressants in the treatment of Huntington's disease? A. To prevent the progression of the disease. B. To treat the motor symptoms. C. To manage mood disturbances and depression. D. To improve cognitive function. Answer: C. To manage mood disturbances and depression. Rationale: antidepressants, such as SSRIs, are used to manage mood disturbances and depression in individuals with Huntington's disease. They do not prevent the progression of the disease, treat motor symptoms, or improve cognitive function. 70. What is the main cause of death in individuals with Huntington's disease? A. Suicide. B. Respiratory failure. C. Heart failure. D. Hepatic failure. Answer: B. Respiratory failure. Rationale: respiratory failure is a leading cause of death in individuals with Huntington's disease, often due to weakness in the respiratory muscles. Suicide and heart failure may also occur but are less common causes of death. 71. What is the role of physical therapy in managing Huntington's disease? A. To delay the onset of cognitive symptoms. B. To manage motor dysfunction and improve mobility. C. To cure the disease. D. To reduce psychiatric symptoms. Answer: B. To manage motor dysfunction and improve mobility. Rationale: physical therapy plays a key role in managing motor dysfunction and improving mobility, strength, and coordination in individuals with Huntington's disease. It does not delay cognitive symptoms, cure the disease, or reduce psychiatric symptoms. 72. Which of the following best describes the pattern of inheritance for Huntington's disease? A. X-linked recessive. B. Autosomal dominant. C. Autosomal recessive. D. Mitochondrial inheritance. Answer: B. Autosomal dominant. Rationale: Huntington's disease follows an autosomal dominant inheritance pattern, meaning that a person with one affected parent has a 50% chance of inheriting the gene mutation. 73. Which of the following is a common psychiatric disorder seen in individuals with Huntington's disease? A. Bipolar disorder. B. Schizophrenia. C. Depression. D. Obsessive-compulsive disorder. Answer: C. Depression. Rationale: depression is one of the most common psychiatric disorders associated with Huntington's disease due to both the neurodegenerative process and the stress of living with the disease. Bipolar disorder, schizophrenia, and OCD are less common. 74. Which of the following can help improve the quality of life for individuals with Huntington's disease? A. Participation in support groups. B. Complete avoidance of social activities. C. Increased medication dosages. D. Restriction of physical activity. Answer: A. Participation in support groups. Rationale: participation in support groups can improve the quality of life by providing emotional support, coping strategies, and social interaction. Avoiding social activities, increasing medication dosages unnecessarily, and restricting physical activity can worsen symptoms. 75. Which of the following describes the typical cognitive symptoms of Huntington's disease? A. Severe memory loss early in the disease. B. Severe intellectual disability from the onset. C. Subtle cognitive changes, including difficulty with planning and multitasking. D. Complete loss of cognitive function. Answer: C. Subtle cognitive changes, including difficulty with planning and multitasking. Rationale: early cognitive symptoms of Huntington's disease are often subtle, including difficulties with planning, organizing, and multitasking. Severe memory loss and intellectual disability typically occur later in the disease. 76. What role does genetic counseling play for families affected by Huntington's disease? A. It provides a cure for Huntington's disease. B. It offers emotional support and informs about inheritance risks. C. It can treat the disease early. D. It ensures the disease will not be inherited. Answer. B. It offers emotional support and informs about inheritance risks. Rationale. Genetic counseling provides valuable emotional support and educates families about the risks of inheriting Huntington's disease. It does not provide a cure, treatment, or guarantee that the disease will not be inherited. 77. Which of the following is a recommended screening tool for monitoring progression in individuals with Huntington's disease? A. Brain MRI. B. Unified Huntington's Disease Rating Scale, UHDRS. C. Genetic testing. D. Cognitive function tests only. Answer. B. Unified Huntington's Disease Rating Scale, UHDRS. Rationale. The Unified Huntington's Disease Rating Scale, UHDRS, is commonly used to assess the progression of symptoms in individuals with Huntington's disease, including motor, cognitive, and psychiatric symptoms. MRI and cognitive tests are part of the monitoring, but are not primary screening tools. 78. Which of the following is the first sign of Huntington's disease in most individuals? A. Cognitive decline. B. Chorea, involuntary movements. C. Psychiatric symptoms like depression. D. Ataxia, lack of coordination. Answer. B. Chorea, involuntary movements. Rationale. Chorea is typically the first noticeable symptom in Huntington's disease. While cognitive and psychiatric symptoms eventually appear, they generally emerge after the motor symptoms. 79. Which of the following interventions may be considered to treat motor symptoms in Huntington's disease? A. Antidepressants. B. Antipsychotic medications. C. Levodopa therapy. D. Acetylcholinesterase inhibitors. Answer. B. Antipsychotic medications. Rationale. Antipsychotic medications such as tetrabenazine are often used to help manage the involuntary movements, chorea, in Huntington's disease. Antidepressants, levodopa, and acetylcholinesterase inhibitors are not effective for motor symptoms. 80. Which of the following is an early symptom of Huntington's disease that can significantly affect an individual's ability to perform daily activities? A. Memory loss. B. Impaired coordination and motor skills. C. Impaired vision. D. Loss of bladder control. Answer. B. Impaired coordination and motor skills. Rationale. Impaired coordination and motor skills, such as difficulty with balance and fine motor tasks, are early symptoms of Huntington's disease that affect daily activities. Memory loss, vision problems, and bladder control issues generally occur later. 81. Which of the following is a common speech symptom in individuals with Huntington's disease? A. Slurred speech and difficulty articulating. B. Rapid speech with no pauses. C. Speech becomes overly quiet and faint. D. Inability to speak at all. Answer. A. Slurred speech and difficulty articulating. Rationale. Slurred speech and difficulty articulating are common in individuals with Huntington's disease due to the motor impairments affecting the muscles responsible for speech. Rapid speech and faint speech are less common. 82. Which of the following is the most effective approach for managing the psychiatric symptoms of Huntington's disease? A. Cognitive behavioral therapy, CBT. B. ECT, electroconvulsive therapy. C. Medications like antidepressants or antipsychotics. D. Surgery to remove brain tissue. Answer. C. Medications like antidepressants or antipsychotics. Rationale. Medications such as antidepressants or antipsychotics are commonly used to manage psychiatric symptoms like depression, anxiety, and irritability in Huntington's disease. CBT and ECT may be helpful in some cases, but medications are typically the first-line treatment. 83. Which of the following is a common challenge for caregivers of individuals with Huntington's disease? A. Difficulty managing medical costs. B. Lack of emotional support from family. C. Difficulty dealing with progressive behavior changes. D. Finding appropriate housing. Answer. C. Difficulty dealing with progressive behavior changes. Rationale. One of the primary challenges for caregivers is managing the progressive behavioral changes, including irritability, depression, and aggression. While medical costs, emotional support, and housing can be challenges, behavior changes are the most impactful. 84. Which of the following is an early sign of psychiatric symptoms in Huntington's disease? A. Sudden onset of hallucinations. B. Irritability and mood swings. C. Extreme apathy and lack of motivation. D. Total loss of social skills. Answer. B. Irritability and mood swings. Rationale. Psychiatric symptoms in Huntington's disease often begin with irritability, mood swings, and changes in personality. Hallucinations, apathy, and social withdrawal typically emerge later in the disease. 85. Which of the following medications is commonly prescribed to reduce chorea, involuntary movements, in Huntington's disease? A. Levodopa. B. Tetrabenazine. C. Risperidone. D. Atropine. Answer. B. Tetrabenazine. Rationale. Tetrabenazine is commonly prescribed to reduce chorea in Huntington's disease. Levodopa is used for Parkinson's disease, risperidone is an antipsychotic, and atropine is used for other conditions. 86. In which part of the brain does Huntington's disease cause the most significant damage? A. Cerebellum. B. Basal ganglia. C. Hippocampus. D. Cerebral cortex. Answer. B. Basal ganglia. Rationale. Huntington's disease primarily affects the basal ganglia, which is involved in movement control and coordination. While other areas of the brain may also be affected, the basal ganglia is the most significantly impacted. 87. Which of the following is the primary risk factor for developing Huntington's disease? A. Genetic mutation in the HTT gene. B. Exposure to neurotoxins. C. High-fat diet. D. Family history of mental illness. Answer. A. Genetic mutation in the HTT gene. Rationale. Huntington's disease is caused by a genetic mutation in the HTT gene, which leads to the production of an abnormal protein. A family history of the disease is a significant risk factor, but the primary cause is the gene mutation. 88. Which of the following diagnostic tests can be used to monitor the progression of Huntington's disease? A. PET scan. B. Genetic testing. C. MRI scan. D. Liver function tests. Answer. A. PET scan. Rationale. PET scans can be used to monitor brain function and progression of Huntington's disease. Genetic testing is used for diagnosis, while MRIs may show brain atrophy and liver function tests are not used to monitor disease progression. 89. Which of the following factors can worsen the symptoms of Huntington's disease? A. Stress. B. Adequate rest and sleep. C. Physical exercise. D. Balanced nutrition. Answer. A. Stress. Rationale. Stress can worsen symptoms of Huntington's disease by exacerbating psychiatric symptoms and motor difficulties. Adequate rest, physical exercise, and balanced nutrition can help improve the overall condition of individuals with the disease. 90. Which of the following symptoms of Huntington's disease may require the use of antipsychotic medications? A. Motor coordination difficulties. B. Chorea, involuntary movements. C. Hallucinations or delusions. D. Depression. Answer. C. Hallucinations or delusions. Rationale. Antipsychotic medications may be used to manage psychiatric symptoms such as hallucinations or delusions, which can occur in later stages of Huntington's disease. Motor difficulties and chorea are managed with other medications. 91. What is the approximate age of onset for Huntington's disease symptoms? A. 10 to 20 years. B. 20 to 40 years. C. 40 to 60 years. D. 60 to 80 years. Answer. C. 40 to 60 years. Rationale. Symptoms of Huntington's disease typically begin between the ages of 40 and 60, although they can appear earlier or later. Onset before 20 years old is considered juvenile Huntington's disease. 92. Which of the following interventions can help individuals with Huntington's disease maintain independence for longer periods? A. Engaging in high-intensity physical activity. B. Daily occupational therapy. C. Avoiding all cognitive challenges. D. Reducing social interaction. Answer: B. Daily occupational therapy. Rationale: daily occupational therapy helps individuals with Huntington's disease maintain functional independence by teaching adaptive strategies for daily living. High-intensity physical activity, cognitive challenges, and social isolation are not recommended. 93. Which of the following conditions may be misdiagnosed as Huntington's disease in its early stages? A. Multiple sclerosis. B. Parkinson's disease. C. Alzheimer's disease. D. Amyotrophic lateral sclerosis, ALS. Answer: B. Parkinson's disease. Rationale: Parkinson's disease and Huntington's disease share some overlapping motor symptoms, such as tremors and rigidity, which can lead to a misdiagnosis, especially in the early stages. 94. What is the primary focus of genetic testing in the diagnosis of Huntington's disease? A. To identify the number of CAG repeats in the HTT gene. B. To measure levels of dopamine in the brain. C. To assess the function of the basal ganglia. D. To test for vitamin deficiencies. Answer: A. To identify the number of CAG repeats in the HTT gene. Rationale: genetic testing focuses on identifying the number of CAG repeats in the HTT gene, which determines whether an individual has inherited the disease-causing mutation. Other tests are not used to diagnose Huntington's disease. 95. Which of the following is an important dietary consideration for individuals with Huntington's disease? A. High-calorie, high-fat diet. B. Low-protein, low-carbohydrate diet. C. Adequate protein and calorie intake to maintain weight. D. Complete avoidance of fats. Answer: C. Adequate protein and calorie intake to maintain weight. Rationale: individuals with Huntington's disease often experience weight loss due to motor symptoms and difficulty eating. It is important to ensure adequate protein and calorie intake to maintain weight and prevent malnutrition. 96. Which of the following should be considered when assessing the psychological impact of Huntington's disease on family members? A. The potential for genetic testing of other family members. B. The emotional burden of caregiving. C. The likelihood of a cure for the disease. D. The financial costs of treatment. Answer: B. The emotional burden of caregiving. Rationale: the emotional burden of caregiving is a significant psychological impact on family members. Genetic testing, the financial costs of treatment, and the likelihood of a cure are secondary considerations. 97. What is the primary goal of treatment for individuals with Huntington's disease? A. To cure the disease. B. To slow down the disease progression. C. To manage symptoms and improve quality of life. D. To reverse brain damage. Answer: C. To manage symptoms and improve quality of life. Rationale: while there is no cure or way to reverse the damage from Huntington's disease, treatment focuses on managing symptoms and improving quality of life. Slowing disease progression or reversing brain damage is not currently possible. 98. Which of the following interventions is most likely to help with the social and emotional well-being of individuals with Huntington's disease? A. Social engagement activities. B. Solitary confinement to reduce stress. C. Strict restriction of social interactions. D. Complete dependence on caregivers. Answer: A. Social engagement activities. Rationale: social engagement activities can help individuals with Huntington's disease maintain their emotional well-being and provide a sense of normalcy and community. Solitary confinement, restricting social interactions, and complete dependence on caregivers are not recommended. 99. Which of the following motor symptoms may occur in the later stages of Huntington's disease? A. Rigidity and bradykinesia, slowness of movement. B. Tremors and muscle spasms. C. Hyperreflexia, overactive reflexes. D. Loss of fine motor skills and coordination. Answer: A. Rigidity and bradykinesia, slowness of movement. Rationale: in the later stages of Huntington's disease, rigidity and bradykinesia may occur, similar to Parkinson's disease. Tremors, hyperreflexia, and loss of coordination can also be present, but rigidity and slowness are more common in the later stages. 100. What is the life expectancy for individuals diagnosed with Huntington's disease? A. 10 to 20 years. B. 20 to 30 years. C. 30 to 40 years. D. 40 to 50 years. Answer. A. 10 to 20 years. Rationale. The life expectancy for individuals with Huntington's disease is typically 10 to 20 years after the onset of symptoms. However, this can vary depending on the severity of symptoms and complications.